Intermountain Healthcare has teamed up with suicide prevention stakeholders that include gun owners across Utah to provide a free training course to help clinicians talk about life-saving conversations with at-risk patients. The campaign also includes a key message about safe gun storage.
We use firearms, many of us, to protect ourselves and our family. This is just the next logical step. If we're going to protect our families, we need to protect them from those times when a person may not be in their best mind.
Clark Aposhian is the chairman of the Utah Shooting Sports Council. He says we may have differing views about guns, but he says there's one message everyone can get behind.
One thing we can absolutely agree on is that firearms should not be a part of an environment where someone has a suicidal tendency.
It turns out that guns are the leading method of suicide here in Utah. And if you look at all gun deaths, 85% of them are suicides. So we've been collaborating with gun owners, health professionals, veterans groups, policymakers to say we may bring different priorities, different politics, but we can come together on this common goal, which is that no person in suicidal crisis should ever have access to a firearm.
Marissa Henn, Community Health Program Director at Intermountain Healthcare, says there's now an online course providing skills and tools for clinicians to identify people who are at high risk and ask them about their access to firearms and other fatal means of self-harm.
We're helping clinicians, doctors, nurses, therapists learn to talk about guns through a new course called Counseling on Access to Lethal Means, or COM. It's tailored to Utah. And the idea here is that we can advance this new social norm while respecting gun rights, while respecting the Second Amendment. So the key is putting time and distance between that individual and a firearm. Doing just that simple step can help them get the help they need, recover, and live a good life.
The key to putting that time and distance is keeping the guns away from someone with suicidal thoughts.
Take the magazine out, put it right through the ejection port and down through the magazine well. Then secure that, turn the key, and it's locked.
Aposhian adds not only can you lock the gun away, but another option is leaving the gun with a friend or family off-site until the suicide crisis ends.
90% of people who survive even a very serious suicide attempt will not go on to die by suicide during their lives. So a life saved in the short term is usually a life saved in the long term.
And stay tuned next month for a big campaign announcement with private and public funding on the same message of promoting safe gun storage and preventing suicide. Now, if you or someone you know is struggling with suicidal thoughts, call the number on your screen right now. It's the Suicide Prevention Lifeline. It's 800-273-8255.